Okay, good afternoon, everybody. Thank you for joining the webinar this afternoon. This is one in a series of webinars that Thrive hosts with the collaboration of our partners. And you'll see today the topic for the webinar is mental health, sickness absence, and the power of prevention. So we're really going to focus on mental health as a difficulty in the workplace and really think quite hard about how we prevent mental ill health in the workplace and what organizations can do to try and think about prevention. We've got an opportunity for you to join in the discussion today. So if you're familiar with Zoom, you'll know that there's a question and answer box where you can populate any questions that you may have for any of the panel, and we'll do our best to get to those towards the end. Or if we see that there's a really important question, we may well pause and bring that into the discussion. So we'd love to hear from you. Please be mindful that we can't address specific issues, and we will be thinking about things in general terms, but we hope that this carries on for a conversation in the workplace. So it's our intention today to really start a process, and hopefully that will be something that you carry on amongst yourselves with your colleagues. So I'll introduce myself first. So I'm Adam Huxley. I'm a consultant clinical forensic psychologist by profession, and I'm one of the co-founders of Thrive, along with my colleague Andreas, who's a consultant psychiatrist. We founded Thrive in 2012 with a really simple mission that seemed quite complicated at the time, and that was to try and improve the delivery of mental health services. And we were both jobbing clinicians at the time, we still are now. And in our clinics, we would see people who've typically waited 6 to 12 months to get the support that they desperately needed. And we thought that we could try and do something about that with a focus on making use of a digital solution to support prevention. So there's a real important mission for us to try and prevent people from becoming mentally unwell in the first place. So we thought the best way to do that was to try and think about how we could deliver that at scale. And we thought the best way to do that would be to make use of a digital solution. So what we have today, just to sort of run you through this, if you're interested, and you can see a QR code there in the bottom right-hand corner, so you can find out more. We work with over 3,700 organizations across the world, which is absolutely fantastic. It's allowed us to reach over 4 million people, which we would never do in our careers if we just used the sort of clinic-based model. And we have an opportunity to detect difficulties before they become really complex mental health problems. And within the app that is the sort of main delivery model, we have built-in access to talking therapy. So people are able to actually speak to a counselor through the app if they have needs that require face-to-face solutions. So that's just a pretty brief intro to Thrive and me, and Jenny's on the call as well, who's a colleague of mine. And if you're interested in learning out more, then please do check it out on that QR code. So we're very grateful to the panel who have joined us today, and it's great to have such a diverse range of expertise. So our thanks to Nick, Neil, and Kent for taking time out of their very busy schedules to help us with the webinar today. And I'll pass over to each of them individually just to hear a little bit more about their roles and some of their really interesting work. So Nick, if I could come to you first, please, if you could just tell us a little bit about yourself and some of the work you're currently involved in.
Yeah, afternoon everyone. I'm Nick Pahl, Chief Executive of Society Occupational Medicine. Very pleased to have Neil as our trustee too. So about the SOM, I mean, hopefully many people on this webinar will know about us. If not, here's a brief, actually a breaking news. Also, we've got a new patron announced today. So Lord Poppet, who's a Conservative peer and has contributed a lot in terms of trade and also interested in health, We've announced him today as our new patron, along with Carol Black, Sir Norman Lamb, and David Blunkett. And we've got a evening reception, which is looking at this launch of this art and occupation book where Lord Puppet is going to be turning up. So Neil, I know you're coming along today, so you can say hello, which is pretty great. So we were established back in 1935, which you could say actually is quite late for kind of industrial Britain, and actually we should have been established perhaps earlier to help those workers as Britain industrialised, but established in 1935, good for those people who are doing that. And we've got a multidisciplinary membership, so all occupational health professionals are welcome, be they doctors, nurses, psychologists, and we do a lot of this multidisciplinary working to get those different aspects from the guidance we've got on HAVs or neurodiversity. And our aim is to support members in their career development. Got regional groups, national networks, hopefully will help people's employability, and we do lots of things like job ads and events and things, and careers fairs. Sort of number one member benefit, along with lots of other things like insurance for nurses and support for doctors' insurance, is this Journal of Occupational Medicine. So that's just here, really good read, and Neil contributes to that too, and hopefully many of you do too. And we're also looking to promote occupational health, and we've got the second year of an annual awareness week, which is June the 19th to 24th, which coincides with our conference. So we're looking to promote occupational health to businesses, but also encourage people to come and work in occupational health. And we've actually got a scholarship fund out at the moment, so £50,000 to support people's career moving into occupational health. I think there's a couple of other slides. Back in the next slide, yes. With Public Health England, we were funded to do these fact sheets, which covers a lot of the things we're going to be talking about today, from age diversity, diversity inclusion generally, good work, managing stress, burnout, fatigue, particularly difficult for health care workers. And again, Neil's an expert in that area. And then sort of these core things like supporting mental health and well-being, developing a strategy, and that's kind of, I'll be on repeat on that in terms of taking a systematic approach, and then managing change. And there's a lot of change happening in workplaces too. And then finally, hopefully, I haven't been too pluggy, but here's a final plug for our conference, which is in Edinburgh, 22nd to 24th of June. So do come along to that. And I'll hand over to that. I have someone else on.
Thanks, Nick. That's really interesting stuff. Yeah, Neil, over to you now. I know you don't have any slides, but yeah, we'd love to hear about some of your work at King's College.
Thanks very much, and thanks for inviting me to be part of this panel. So I'm Neil Greenberg. I'm a psychiatrist. I served in the military for about 23 years as a doctor and then as a psychiatrist, and have been to lots of interesting places around the world with that. I retired about 8 years ago, and from the military, that is, and work at King's College London, where I work on a military health set of research projects, but also a health protection research unit, which looks at organisations that predictably place people into highly challenging situations. And so I've got a lot of research work which has looked at mental health in the workplace. At the Royal College of Psychiatrists, I chair the special interest group in occupational psychiatry, and I also am leading the World Psychiatric Association Mental Health in the Workplace position statement. And so my interest really is, how do you keep organisations functioning well? And I strongly believe that actually, if organisations invest well in mental health in the workplace, that's not only morally the right thing to do and will avoid, hopefully, a lot of legal claims. I do expert witness work as well, but also it will help operationally in terms of delivering better outputs, and also creates a good reputation. And if you're a good, reputable organisation, you're likely to get better staff and to keep the staff that you've got. And so my last plug is that if you do Twitter, I'm on Twitter at Prof. N. Greenberg. We try and pump out all our academic papers on that Twitter handle. And so please do have a look, and glad to be here. Thank you.
Thank you very much, Neil. That sounds really interesting, and I'm sure we'll cover some of those topics during the rest of the discussion today. Last but no means least, Ken, welcome and thank you for taking the time.
Hello, good afternoon, and thank you for inviting me today. I'm really delighted to be part of the panel. A little bit about me. I am a consultant occupational health physician. I am clinically active. I work for a company called Medigold, which some of you may know is a national occupational health provider, covering lots of different clients, a real eclectic a bunch of clients, and we do our best to provide a very high quality occupational health service in all its guises. Like Neil, I spent a lot of time in the military, both the Army and the Navy. I retired from the military in 2018 and spent a bit of time overseas in the Middle East, returning to the UK about a year ago now to start work with Medigold. As I said, I'm a to some degree a jobbing occupational health physician. I have some management responsibilities, but my clients currently involve the police and fire services in Surrey and Sussex, and also looking at providing some medical screening for one of the aviation companies in the UK. So the mental from the police and fire perspective, there is an awful lot of mental health morbidity that needs to be addressed, and as I say, we do our best to deliver a high quality capability in that regard. But I'm really interested to share some thoughts today, and really delighted to be part of the panel. Thank you.
Thank you so much. Yeah, and I guess at that point we kind of just sort of acknowledge that we are narrowing in very much on mental health, but of course, physical health impacts upon mental health and vice versa. So there are many reasons that people are sick or absent from work. But our focus today is obviously on mental health. So just to sort of contextualize the webinar today, and of course, these are sort of only general touch points, but they're certainly, pretty consistent with what we've seen here at Thrive. And I don't know if these are surprising for you, but just that first sort of figure there, 1 in 6 people suffer from a work-related mental health condition in any given week, and you may feel that's an under or overestimate. And I think as we've sort of heard, there are certain groups, certain sectors that seem to be disproportionately more affected with mental health difficulties, and we've put up there, certainly again from our experiences, we've seen a lot of a much more higher prevalence within healthcare sectors and education. And again, that's probably not surprising for people. And given what we've seen with the way services have had to adapt and change to the back of COVID, that might not be that surprising for you. So, yeah, and of course, there's huge economic costs for periods of absence from work, and we've heard a little bit about some of the benefits of beginning to think about how you might support employees and their mental well-being. I'm really pleased to say over the 10+ years that I've been involved in this and the discussions that we've had with organizations, it's moved very much from a sort of moral or ethical standpoint to an absolute must-have, and people are really taking it seriously now, which is great. And conversations, thankfully, are a lot easier around mental health than maybe they were 20, 30 years ago. So yeah, that kind of brings us nicely onto what we're thinking about here. That's, how do we build a preventative well-being strategy? So for those of you who are listening, just to maybe pause and think about what you currently have. And for those that don't have a strategy at the moment and are curious about what that might look like, we'd love to hear your thoughts on it. So this is just a placeholder slide really, but I think we'd really like to hear from the panel, from their experiences of thinking about this issue. So Ken, if I could come to you first, if that's okay.
Of course.
Yeah, so thinking about building a preventative wellbeing strategy, just tell us a little bit more about what you feel are the most important parts to include in building a wellbeing strategy.
Yeah, so I think first of all, one needs to identify a working definition of well-being. And if I can just highlight a couple of publications, and I should say that there is a vast amount of literature out and about regarding well-being and in the workplace and in general. So to some degree, it's difficult to hone in on the sources of information that are reliable and useful, more importantly. But there are a couple of documents, two of which Nick has already highlighted. These are pamphlets produced by the Society, and I believe the principal author is Gail Kinman from Birkbeck, and these are very contemporaneous documents supporting workplace mental health and well-being in COVID and beyond, and a sort of related document, mental health and well-being strategies during the well-being during the COVID pandemic. Those I have found as being really useful documents. But to come back to the question, a definition of well-being and how does one build that? Well, if we understand that, you know, well-being within organizations is both individual and organizational components. In the document that Gail has written and sponsored by the SOM, we're looking at 5 different components: health, work, values, principles, collective and social approaches within the organization, and personal growth. Those sort of 5 components of well-being. And if you are intent as an organization on embedding that definition and embedding excellence in all those areas, then I don't think it will be any surprise to anybody that, you know, this should be a dominant program concern for senior management and any members of the any senior members of the executive boards, and it does demand to implement changes if changes are needed. It does demand you know, senior management-led approach across all key stakeholder domains, and those domains will be different in different organizations, you know, delivering different outputs, whether they're small, medium, or large organizations. So my sense is that there's no question about this. It needs to be, the strategy needs to be driven by senior management, and we can talk about, you know, how you go about developing a strategy that's fit for purpose in your organization, but delivery has to come from the top.
I've got a question, actually. It's very pertinent to what you're talking about, and it is, how do we get buy-in from CEO, from the execs, the board? It can be very difficult. They want to tick boxes but not spend the time, money and energy. How do they get that kind of buy-in? Do you got any ideas about that?
Would you like me to have a go answering that, Jennifer?
Yes, please, Ken.
Yeah. So one other document that I would recommend that everybody has a look at is the recent document produced by Pahl Nicholson. Again, it's an SOM document called Occupational Health: The Value Proposition, and it builds upon its earlier iteration from, I believe it was 2017, or several years ago anyway. And it talks about workplace health promotion and the evidence for that, and costs and so on. But again, it may not come as any surprise that while employers, and I'm quoting here, while employers largely agree with the principles of looking after employee health and well-being, it's not always a high priority for investment, and only half of those employers surveyed believe it provides a financial return. And I know that those leads into lots of other different avenues for discussion, but my sense is, how do you get buy-in? Well, you can talk about return on investment, you can talk about cost effectiveness and effectiveness, but just picking up on what Neil was talking about, of the drivers for well-being and occupational health, let's say, as well, is the moral component, and focusing more on persuading those who make decisions within organizations to look at possibly the benefits from the intangible benefits, the tangible costs, such as presenteeism, engagement, staff turnover, etc. So, and I'll just finish by saying that there are real challenges in producing evidence for the benefit of well-being interventions. There is some, and I'm really pleased to say that there is emerging evidence of the benefit of virtual or sort of e-health interventions, particularly in the mental health sphere. So it is a question of engaging with the decision makers, providing them with persuasive arguments, but maybe not necessarily the classic return on investment, pounds and pence arguments, because that is really, really difficult to provide in this area.
Yeah, thanks, Ken. Nick and Neil, I don't know if you've had anything else to add to that.
Well, I'd add from my point of view. I mean, I agree what Ken says, that there's kind of two things. So one is on the evidence. Whilst the evidence of return on investment, I agree, is hard. One study which was done in Australia, which was really good quality, published in Lancet Psychiatry, which is a great journal, and basically it involved New South Wales firefighters. And what they did was a randomized controlled trial, which is a high quality trial. And they trained up some fire station managers in how to have what we call a psychologically savvy conversation. So to speak to their other firefighters about their mental well-being, particularly after nasty events. And of course, firefighters see plenty of those. And the control arm didn't get any intervention. They looked at the sickness absence costs in the 6 months beforehand and the 6 months after the intervention. They published it, I say, in a UK journal, so it was in pounds and not dollars. And they found that for every £1 invested in that training, it saved £10 in sickness absence over the following 6 months. When we looked at our data in Afghanistan, our troops who were on the ground when I was in the military, went out and we gathered data from troops doing the job, you know, under difficult conditions. We found that if you had good junior supervisors, they reported 1/10 of the rate of PTSD than people who felt their immediate supervisor was not supportive. So I think the evidence that is available on impact on mental health and impact on costs shows that actually training up junior supervisors to be able to talk to staff about their mental well-being is a really strong return on investment. We did a study in COVID times where we designed a 1 hour training package we delivered over Zoom like this, in order to help junior supervisors within the NHS talk to their staff about mental health. And we've published that in Occupational Medicine, I think last year. And basically we showed that a 1 hour training course that had some practical elements to it, it's called a React package, again, almost doubled the rate of supervisors who felt confident to speak to their staff, went up from about 40%, 45% to about nearly 90%. And basically, so what I'm saying is the simple things such as training up junior supervisors is really impactful. It need not cost a lot of money. And I think persuading the people at board level to buy into it is well and good. And I agree, obviously, you need to do that. There was a great adage in the military. It said the psychological welfare of troops is primarily a chain of command responsibility. And it also said that the psychological welfare troops is basically a force multiplier. And I know this is all very military stuff, but what it says is that even an organization like the military recognizes that if you want people to fight well, or in business sense, to deliver well, you absolutely have to look after their mental health. But the thing that we found, certainly within the military, and we found this, I run a small training company, within lots of other organizations, is that once the board signs off on, yes, we have a strategy or we have a plan, making that plan work depends primarily on the middle and junior managers. So it's all very good, the CEO saying, make this happen, but if you don't get buy-in from the grassroots, from the shop floor, then things don't happen. And then it can become very much a tick box exercise. So as well as getting the board to buy in, you absolutely have to persuade the enablers, the junior managers and supervisors, that actually what you're proposing is going to fit with them. And we did that within the Royal Marines back in the late 1990s. We designed a program called TRIM, Trauma Risk Management, which is a peer support program. And the reason it worked wasn't that the senior officer, the Commandant General of Royal Marines, it wasn't that they signed off on it, is that we've got the sergeants and sergeant majors, the middle managers, to agree it was a good thing, and they could see value for themselves in what they were doing on the shop floor from this program, which is why it took off. And we've now done 13 research projects on it, and it's well used. Over 50 NHS trusts use it. So getting buy-in from the shop floor for whatever you're proposing is also really, really important.
Yeah, I'd agree with that, because if you just do top down, then there's nothing bottom up. You need to both, don't you? I suppose just building on what Kent was saying in terms of the value proposition document, there's three areas, key drivers for kind of making the case, to that sort of top level decision makers. The financial one, I think we've covered that, and I think there's something came out from Deloitte, which I've put in the chat in terms of ROI. There's a legal side. No one wants a legal case against them, and I think particular sectors are very worried about that. Construction, they can't get future contracts if they've on the legal kind of some kind of legal issue. And then there's a moral case, and we're looking at this big change in the workforce at the moment. The Great Resignation, difficult to get sort of talent, and if you're kind of seen as a morally kind of robust company in this area, then you maybe would get that talent. And then also about finding the right time to ask the board. I mean, there are kind of mental health awareness weeks or particular moments where you can say, look, now's the time to do something. So I just build on that. But I do agree both what Kent's saying in terms of kind of ROI and value proposition and the bottom up, and having those sort of champions right the way through the organization, because otherwise there's a certain superficiality about, even if the top level do buy in and you ask them at the right time and you make the case in the right way, that doesn't really lead to impact on the shop floor or everyone else in the organization.
Sorry to jump in again, though. I think one of the other things that I think is important, particularly from an occupational health point of view, is that sometimes organizations are really well-meaning, and they might roll out programs such as mental health first aid because that sounds good and it seems to be doing something. But actually, again, not trying to give mental health first aid a hard time, because it's done an awful lot of good. But if you look at the Health and Safety Executive's review of mental health first aid in the workplace, done in 2019, I think, it shows that there's no evidence that it makes any difference. So I think sometimes a well-meaning HR director or well-meaning board may want to roll things out, but they really should be turning to their occupational health staff and saying that we want to do this. What's the right way? What evidence is that out there to show what will work for our organization, rather than just jumping in there and rolling stuff out without thinking about whether this really suits them, and of course whether there's evidence that it actually makes a difference.
Yeah, no, absolutely. I think that's maybe the sort of brokerage right at the start, just to sort of get a wider organizational buy-in to something like this. And I think we've got a few questions later on that talk about sustainability, which is really about making sure that something's embedded longer term, so that future generations of employees can benefit from it. Thanks, that's really interesting. I don't know if there's any other chat questions that have come in, Jenny, that you might want to pull out. Then we'll go on to the next slide. So yeah, there's just a few discussion points there with some recommendations around documents that you can access and read, that you might bring into your discussions when you're thinking about developing a strategy. But what would it look like? So how are you going to achieve a well-being strategy? And we've talked about things that you might try and focus on in terms of building the case. But we're thinking about data that might also support a case to bring in a strategy into your organization if you don't have any. Nick, if I could come to you first on this one. So the question is, what do you think organizations can look at in terms of data that might help identify and track well-being?
Well, I put in about what works well-being in the chat, which have got a good questionnaire. And I just think it's important, whatever data you collect data, and then you track it, and then there's meaningful kind of action from that. So you take a kind of whole organization approach, be it on some of these stress management standards from the HSE, which is always a good place to start. And then you track data according to it. I mean, I think we still lack kind of effective kind of benchmarking across organizations, but different organizations are different, isn't it? So I think it's about seeing what's right for your organization, checking the data according to, for example, that questionnaire, and then doing a systematic kind of interventions in a strategic way against that. I mean, I know some companies, in the world of AI and sort of much more live data. So I heard of, I think IBM were sort of tracking sort of discussion within staff forums on particular issues. And so, for example, I think there was a discussion about menopause on sort of staff discussion forum, which they then picked up through kind of an AI bot, and then almost in real time, within a day or two, sort of put in place something on menopause in the workplace. So it's much more kind of rapid response, which obviously I think creates a sense of kind of reassurance from staff that this is taken seriously. But then you could say there's certain superficiality about it. It's just looking at one issue that sort of particular people are looking at. And I think fundamentally my message is take a systematic review, look at data across those kind of key areas of well-being, and then intervene in a strategic way according to that. But I'd be interested to know, from Kent and Neil, so what they think on this issue, because it is emerging, but data is key, and that's where everything comes from.
Yeah, Neil, just wonder if we could come to you and your experience, and maybe from your publications, what you found out about data and its usefulness in being able to sort of identify issues or even think about prevention.
Yeah, so I mean, our take on it is from an independent research point of view, particularly for big organizations, is shown to be really, really useful. There's this kind of difficulty in how do you gather the data to its utility, and I'll give you the example of screening as so many military forces, and indeed many emergency services, now the European Aviation Safety Agency, that they all want to screen their troops using psychological measures in order to try and identify individuals that might have problems in order to get those individuals help, and that's a very well-meaning strategy. But actually the evidence is that it doesn't work, and it doesn't work because often screening is only a point in time. It's also the case that people are very suspicious about what will happen to the results that they give. Will it impair their job? How does that get communicated? Who gets to know? And so the intent there is when you're trying to help people's mental health, but actually by using a screening program, but actually it doesn't give you the information that you really want. And so things such as, on the list there, things like sort of staff turnover and absences and, mistakes and compliments, those sorts of things are actually more likely to be more effective in terms of measuring effective output than actually trying to find a formal mental health measure, unless it's done as an independent sort of research evaluation point. And even then, we did a study in Iraq in 2009 where we gathered data from 600 troops who are on the ground, and we told all of them very, very clearly that this was not a way of finding out who needed help. It was a way of trying to identify how the whole force was doing. But we gave out half the questionnaires were anonymous, and the other half we could have found people if we wanted to. And in the ones that we could have found, they reported 1/3 of the rate of traumatic stress symptoms than the ones we couldn't find. So even when you say to people that this is really trying to gather data on you, and we're your employer, we're trying to look after you, people are very reticent to tell the truth. So I just wouldn't be misled by the idea of trying to gather data on your own people to identify how things are doing, because sometimes it might give you an answer that doesn't reflect reality. Whereas if you use hard measures such as absences or staff turnover and the like, that's likely to be more useful. I guess one other thing to say is that what can be really useful if you've got things such as staff surveys isn't just to look at any one particular measure, but to try and track trends over time. And those trends aren't always about what's necessarily going on in the workplace itself. They can also be about what's going on elsewhere in the world. And the pandemic is a great example of that. So there are lots of things that impact upon people's well-being, which actually are completely unrelated to the workplace. And I think it's important to keep that in mind. And Nick's little story there, which I think was really good about menopause, although that's clearly not a work issue, it definitely has an impact upon work if it affects a worker in the workplace. So I guess my caution in terms of strategy, in terms of data, is research is good, particularly if it's anonymized research. But we have to be careful about gathering data on mental health within organisations because of the concerns about how people might use it.
Just a quick well-being. So we've got lots of nice horses. The military. I don't know if you can see out the window. Sorry, this is completely irrelevant. There's the kind of cavalry going through with their guns by Regent's Park. So that's kind of
are they
a well-being
moment.
I don't know if it's, look at that, isn't it? And they're kind of playing their trumpet. So that's a random sorry to intervene, but that's kind of glamorous, isn't it?
Yeah, absolutely.
Anyway, I'll shut up now.
No, that's great. Thank you. And we didn't plan that, but it's good that that happened. Ken, just to come to you on data. I mean, I think, the point about, maybe having a wider set of metrics to inform, decision-making processes. And I think certainly just from what you've said, Neil, I think having got past a lot of stigma with regards to mental health in the workplace, what you don't want to do then is to sort of create the impression that data is going to be used to uncover something, or that there are penalties or costs around disclosure. So Ken, I'm just wondering what your thoughts are about maybe even including things that relate to protective factors, because we're focusing on sort of things that might relate to difficulties. Is there any merit in including, some of the protective factor estimates or things that, might be really useful for a strategy to do more of?
Well, I think, I absolutely agree with everything that has been shared so far, particularly about data. But without data, without reliable data, it's going to be very difficult to develop a de novo, let's say, wellness strategy, because you can't always generalize from research. You can't, as we've heard just now, you can't even necessarily generalize or use your own data with huge confidence. So there is a huge challenge there, but without measuring hard data such as absence data or presenteeism, which is even more difficult to measure, you're really going to struggle, particularly as a small employer, to try and get the most bang for your buck out of workplace interventions or occupational health, engaging with occupational health, because you would seek to target your interventions. In terms of there are measures out there, and the NICE guideline, again, this is just recently published, 2nd of March. NICE guideline, definitely worth a read for those who are interested. Does come out with some guide towards using validated measures of mental well-being. There are references to and links to measures there. So I suppose my answer is you've got to ask the right questions to get the right answers to inform what type of interventions you're going to support. And I think you also have to be very clear in your own mind where to choose interventions that are known to be of benefit. And that's where you have to go back to the primary research. I'm certainly not an academic, but you know, you would go to respected publications and seek out those interventions that are going to help and are relevant to your organization, that are going to get worker buy-in, that are going to persuade the senior management that it is worth investing in, rather than, again, I go back to the return on investment, rather than looking for an ROI. Great if there is a very clear ROI, and we need more high quality research in that area. But yeah, it use data for the purposes for purposes that will benefit your organization, but it needs to be targeted and it needs to be evidence-based.
And just to jump in there, this is a cheesy phrase that came up a long time ago, but I think it holds a lot of truth, which is we need to make sure that you make the important measurable, not the measurable important. And what we don't want to do is to be using metrics which seem like they're telling us something and we pay a lot of attention to them when in fact that they're not valid. So I think that's a key thing to keep in mind.
Yeah, no, absolutely. Okay, so
we do have a question, if it's okay, just at this point, because it could be something that's identified in one of those employee surveys. One question is, financial well-being is an important aspect of well-being to consider in today's world. Would you agree, particularly with everything that's going on at the moment with increased costs, people not getting pay rises, that kind of thing? Would that be something that is becoming increasingly important, putting pressure on employees?
So if I jump in, so I think the evidence from national statistics shows that that's very much true, and it's not always about what an employee is paid directly. It's about what the family needs are and what the family income is. So there was the data that has been the COVID mental health tracker that Public Health England, now the UK Health Security Agency, have been pumping out data from, which comes from data sets of 90,000 plus individuals who have been giving data throughout the period of the pandemic, shows that actually it's the people on the very lowest incomes who have the absolutely the worst mental health and sadly the biggest risk of suicide. And we certainly know after the 2008 economic recession that the rates of suicide went up substantially. So I think financial hardship, yes, it can affect mental health, but it also has this very sad potential impact on suicide in people who are vulnerable. So I would agree that that's certainly an important thing to consider.
And if I could just jump in there, the cost of ill health, if you look at it in its sort of macro, in the macro sense, 20% borne by the state, 20% borne by the employer, and 60% borne by individual households. So I really couldn't agree more that financial well-being is a financial the ability to maintain financial well-being is a really key aspect of well-being.
Yeah, I put some stuff in the chat from What Works Wellbeing and Mental Health at Work about this. It's a total driver, isn't it? At the moment, it's really critical and can get really serious for people, these drivers, in terms of performance at work. But there are things, there's useful products actually in terms of salary sacrifice. There's been quite interesting products. So, people who get into serious debt who can then work with their employer to pay that back. And obviously there's cost reduction schemes and savings schemes, well, not really savings, but sort of things that employers can do to help. I mean, it's an absolute crunch at the moment, and very concerning potentially that impact. So I think employers are stepping in. You can see, when you go to these conferences in the city with kind of high level professional service companies, that these are kind of products that employers are looking to provide for their employees.
Just to add that the person asked the question has also pointed out, which I think is actually quite important, training, teaching employees financial literacy. You'd be surprised how many people don't understand how mortgages work and things like that, and credit cards. So yeah, that could be another important thing.
Yeah, no, absolutely. Thanks Jenny, for that question. I think we'll probably try and get to a couple more questions, because I can see there's some really interesting ones. But yeah, let's just imagine that you know, the people listening have then sort of come to a decision about what that strategy might look like. And I guess, you know, we're trying to think about success. So we've talked about maybe all the reasons that an organization might invest in a strategy, and some of the sort of moral, ethical, financial, reputational benefits of putting something together. But I'm just wondering, from your experiences, if I can ask the panel, what sort of outcomes could people expect to see as a result of having a wellbeing strategy? So what have you noticed from some of your work in terms of outcomes that have resulted from a wellbeing strategy? Ken, come to you first, please.
Yeah. So I spent the vast majority of my working life in the military, and if I could just and that's a very unique working environment, and in terms of well-being, there are, from a personal perspective, my sense of well-being was always enhanced through good leadership, leadership of me, I should say, and it's the simple things. It's the encouragement. It's the pastoral support. It's knowing where you're going, what you're doing, and being able, feeling empowered, a sense of autonomy. All of these things will be very familiar to the panel and the audience, I hope. It's in the absence of any formal well-being strategy, my sense is that right at the sort of operational units, right down to the individual worker teams, it is leadership which accounts for the you know, from my perspective, the greatest impact comes from that, and leadership can be in so many different guises, whether it's, to pick up on a point raised just now, whether it's help with your finances, you know, help with your education, help with your developing work specific skills, all of those type of things. That's, to me, part of, you know, if you look at the 5 domains of well-being that we discussed earlier, if you can tick those boxes, even in a very simple way, but you feel well led, then that to me is a real marker of what a good strategy looks like.
Yeah, great, thank you, Ken. Nick, any feedback from you on your experiences?
Well, I think people need to understand it's not a direct link between, you know, well-being intervention necessarily, and, you know, I don't know, sickness absence reduction, or sort of certain metrics that people might think is important. Is, you know, you have to take things in the round. You know, sickness absence is obviously going to be affected by, you know, COVID. If COVID levels are high, then you know, if all the well-being work, and, you know, it's not going to impact on sickness absence. But I suppose it's there are metrics, you know, keeping your talent, your retention, perhaps a kind of, you know, return to work time is reduced. So be careful of what you measure, but do measure. And, you know, sometimes one thing, just you know, hopefully it's related, is I was on a mental health special interest group of the SOM, and someone said, you know, it's this fine balance between presenteeism and absenteeism, where, you know, if someone's got a mental health issue, or sort of, you know, serious well-being issues, then you want them to have time off, but also you want them to engage with the workplace, but you don't want to be too much, because then that's presenteeism. So this is, you know, really the kind of expertise of occupational health. And, you know, sometimes, you know, life is complex, and sometimes there isn't kind of an easy answer, but you do want that professional advice for, you know, that's kind of those phased return to work. I mean, particular case in point, I suppose, is long COVID, not about sort of mental health, but certainly about well-being. And, you know, that this is a condition which, you know, remits, and people have to take time off, and you have to have that careful return to work to allow and people may have to sort of drop out and then come back in. So that's why occupational health is so important. But sometimes it's difficult to actually say, because of this, it's led to that.
Yeah, absolutely. Neil?
I think jumping on those 2 points together about sort of leadership and about getting that balance right, which I'd agree with. I think one of the key things is about how you enable and what skills and what responsibility and authority you give junior managers. And it is junior managers that make the biggest difference to do. So I mean, one of the set of principles that were sort of from military design, but they are equally as applicable in all workplaces, is the PIES principles, which have time and time again been found to be useful in the Israeli military. They did a study back in 1982 when they had the first Lebanon War. They had lots and lots of highly distressed soldiers at the time. They used these PIES principles. I'll say what they are in a second. And basically, they did a 20-year follow-up on these people, published in the American Journal of Psychiatry. And basically, the more of these principles put in place by junior managers, junior leaders at the time, the better the outcome was 20 years later on. So of all the things you might do, it's investing in upskilling, increasing the confidence and increasing the capability and responsibility of junior managers to look after their staff. So the PIES principles, the first one is P for proximity, which goes into what Nick was saying, which is about, you don't just want to send people home, you want to keep them at work, but you want to support them more when they're distressed and temporarily reduce the pressure they're under. And so getting that balance right is really important. You know, so I was speaking to someone this morning, you know, if you've got a barista who's working in Cafe Nero, you know, who's highly distressed and cries all the time, you don't want to be putting that person on the front till, because it's not good for them or for your customers. But there's no reason that they can't clean out the sort of coffee store that you've always been meaning to do for a number of years, and actually might give them a feeling of success and everyone needed it doing. So you can keep them at work and you can support them more. And that is a facet of leadership. Immediacy, and immediacy says that when people are having a tough time, what you don't do is just let it go until the point they hit the wall. Most people with mental health problems only present when things get into crisis or something's really bad. And by having regular discussions with staff about their well-being, you know, even in a general way, by managers, you can identify things early on, solve them so that they don't turn into the crises that unfortunately tend to present with mental health difficulties. E is expectancy. Expectancy says that when someone's been through a relationship breakup or something unpleasant's happening, or it's the middle of COVID, you know, then you should be expecting people to have some symptoms. It doesn't mean they're ill. And you can reassure them that it's okay, you know, we're all in that same boat together. The other bit of expectancy is that if things don't get better, then we will make sure you get to the right professional support. And S stands for simplicity. And often simple things can make a really practical difference. So active problem solving with an employee who's got some difficulties, you know, it can actually really lead to a substantial improvement in their mental health presentation. So if you've got someone who's actually really distressed because they can't use a piece of equipment better and they're very anxious and thinking about it at night, they don't need to come and see me. They need to have better mentoring and support to use that piece of equipment better, or to be moved on to a role that they can do. So I would say that actually, in terms of sort of fitting in with this, how do you measure outcome? If you've got supervisors and managers who are regularly having these well-being conversations and they're doing it well and making differences to their staff, I think you can be pretty sure that you have in place a good strategy to sort of take forward the whole workforce well-being.
I think that's really interesting. I just want to pick up something that somebody's put in the chat, and it's about leadership and trust. And I know that one of the things that people talk about is creating an environment of psychological safety, so people do feel safe to talk about things. And that all comes down to education and training, which is one of the original points you made. Would you agree that creating that culture of psychological safety is really important within organisations?
Absolutely. I'm confident that, you know, 90% or more of supervisors and managers would actually want to support their staff's mental health. I mean, it feels very nice to help someone and to improve them, for them to come and say, thanks, boss, you know, you've made a big difference. Certainly, you know, my time in the military, just like having a boss who you feel has got your back is incredibly important. And so if you can be that boss, if you're there and you're looking out for someone's needs, then that is likely to have really, really huge dividends for both you as the boss, but also for the employee. And of course, that has to be fostered on a basis of trust. And if you think when we do our measures of leadership or quality of leadership in studies, one of the questions we ask is, does the supervisor take on extra duties at the expense of their staff to make themselves look good? So if you're constantly thinking your boss is basically giving you a hard time to get you to do more so that you can make it look good for them to get promoted, that's never going to work. You have to be, we're absolutely in this together and we have each other's back.
Perfect. Thank you. That's really interesting. Jenny, I think we've got just a little bit of time left just to try and pick up any questions that may have come in. I can see there's a lot of debate going on, which is great.
There's no open questions at the moment. I think we've covered, as we've gone along,
Okay.
questions that have come in. Is there anybody that has got any other questions? Please post them now.
Whilst we're doing that, so there's a whole bunch of resources that are available, as you've heard. And I think, yeah, if this is the start of the discussion for you, please carry it on. If it's the continuation of a discussion, please make sure you carry the discussion on so that you can think about getting to a point where you have a wellbeing strategy. And yeah, I'd just like to invite the panel just to offer a closing remark, or just to sort of reflect on some of the things that we've heard today, or offer any additional advice to people who may be thinking about this thing just before we finish. Ken, if I could come to you first.
Yeah, so it's just about the sort of mental health literacy, if you like. And again, for people who are interested, I've just stuck up a link. It's from Gail Kimman. It's one of the references I referred to earlier on. There are, it talks about building resources to help employers. It talks about stress competences for managers, and opening that conversation and destigmatizing mental health in particular, all comes through education. So it's what is needed. It's just get the simple things right, and everything else will follow.
Yeah, thank you, Ken. Neil, any last reflections, comments?
Yeah, I guess I would say that no matter what size organization you are, I think that there's 3 simple or relatively simple things that you could do to take those steps into improving workplace well-being. One is, as I've tried to reiterate, is making sure that your junior managers, your junior supervisors have even a tiny dose, a modicum of training to enable them to feel confident to speak about mental health with their staff, because they should be speaking about it regularly. The second is to try and look at peer support. Is how do you foster an environment in which there's good peer support, and that the team feels that they're not only doing the job, but actually they're looking after each other, because that's really important. And then the last thing I would say that's easy to do is to what's called reflective practice, is that periodically, particularly when you've been through a tough time, rather than just cracking on and going through, is to take a moment to stop for the person who's in charge, to bring the team together and to say, let's just talk about how tough things have been, and to share experience, because otherwise people can go off down these divergent paths of thinking that it's only them who have got the difficulty, or it's all so-and-so's fault. And actually the opportunity to speak about the impact of what's happening and how tough things have been really enables everybody to get a sense of where everyone else is coming from. And it's a cheesy phrase again, but there's this, even if we weren't always in the same boat, we were absolutely in the same storm. So those 3 things, a bit of reflective practice, good investment in supervisors and managers, and some peer support, I think are really effective workplace interventions.
Thank you.
Yeah, good point. My final points is, I mean, I'm very interested to see University of East Anglia and Rand, particularly led by Professor Kevin Daniels, have got a kind of focus in on well-being for managers and teams, and some infographics and resources and tools. So that is coming out shortly. So do look out for that. I think it's coming out end of next month. Big project. It's interesting, today we talked a lot about financial well-being, that being the crunch. So I think that's something I've, sometimes there's things that bubble up, and this is the one of the moment. Hopefully, not too long, although you do worry in terms of sort of cost and cost of living crisis. So something that focuses on that. And I suppose my final comment is this kind of prevent, detect, and treat. You know, take that primary, secondary, tertiary strategic approach, because only through a strategic approach can you show what's really occurred and what works. But it's been a good session. Thank you, Jennifer, and thank you, Thrive, for hosting.
Thank you very much to the panel. You've been fantastic.
Thanks, Nick. Yes, thanks, everyone. Hopefully that's given everybody listening some food for thought, and there's some fantastic links to go and explore this topic in more detail. And yeah, just our thanks to the panel for taking the time and sharing your views with us, and I hope everybody found it really useful.